I want to take us for one more very deep perspective, which is on findings from an evaluation that our Duke University team and colleagues were able to undertake over the last 2.5 years, focused very specifically on the Saving Lives at Birth program. And to review that for us, joining us is Joy Noel Baumgartner, who is a faculty member at Duke University and also leads the Global Health Institute Evidence Lab. So Joy Noel, thank you again for joining us today, and over to you to tell us a bit more about the evaluation and key findings of the SLAB program.
Great, thank you, Krishna. As Krishna mentioned, I'm faculty at the Duke Global Health Institute and director of the Evidence Lab, which works on impact evaluations for a range of programs, services, and technologies that are trying to understand their health impact, including quality of care. So let me just give you a broad overview of what I'm going to try to cover really briefly in less than 10 minutes. So the Evaluating SLAB program has been going on since 2018. I'm going to talk just briefly about the design and the methods that we used, a synthesis of some of the findings that you can find in the really large evaluation report, which I hope some of you will dive into, and some of the key recommendations that we have for SLAB and or similar types of programs that are trying to support maternal and child health innovations in the future, because I think that'll help stimulate the conversation. So just as a big picture recap, so SLAB has funded 147 total awards, and that reflects 116 unique innovations. The evaluation started in January of 2018, and we were tasked with trying to better understand how the SLAB program, which is quite broad, sourced, supported, and scaled innovations, how well it achieved its intended impact, and then also to come up with some sort of data-driven recommendations for potential future iterations of the program. Our broad mixed methods evaluation had 4 evaluation questions. How does SLAB map onto the global landscape of maternal and neonatal health innovation? We know that SLAB's not the only sort of player in this space, and they wanted to understand how it fit into the bigger picture. How does SLAB fill a gap in maternal and neonatal health innovation funding? Again, because it's a very large field. And what was SLAB's impact on sourcing, supporting, and scaling innovations from its inception in 2011 through 2018? And then finally, what was the impact of the SLAB-funded innovations on mortality and sort of the maternal neonatal health ecosystem? So this is really a quite large task for an evaluation. It's called a complex evaluation because of the diversity of the questions. So we had a diversity of methods. There was a quite deep portfolio analysis and landscape review, lots and lots of documents that were generously shared from USAID, Grand Challenges Canada, from the innovators themselves that we reviewed. We conducted over 80 semi-structured interviews with key informants, from innovators, stakeholders, funders, donors, government officials in both high and low income settings. A quantitative survey that we administered online to innovators. And let me just thank the innovators that are on the call, because I see many of you there. We really appreciate your time doing those surveys and those interviews with us. Desk research on sort of the space of philanthropy within maternal and neonatal health. And then we also conducted some cost effectiveness analyses for a subset of the transition to scale grantees. All right, so I'm just going to highlight some sort of big picture achievements, and then also some what we call areas to strengthen or points of discussion, which I think will be interesting for the future panels to dive deeper on. So we sort of organized it in the achievements thinking about sourcing, supporting, and scaling. So under sort of the sourcing area of achievements, there was really clear qualitative and quantitative data, actually, from the survey, that SLAB was able to both inspire and fund a large proportion of early stage ideas, more so than other funders that are in the same space. And that's some sort of a unique contribution of SLAB. Also, the open approach to bringing in sort of new players into the field of maternal and neonatal health was, again, something unique about the SLAB design, and the increased awareness of innovation in and of itself within maternal and neonatal health. It's sort of, it's got a great name, Saving Lives at Birth, but just the way that it was designed and promoted sort of just lifted the field more broadly. In the supporting realm, Ben Sherwell and Patricia, Laura have already talked about, like, you know, you would win the award, but then you were supported throughout the life of the award. And that was really important and valuable from the innovator's perspective, as well as the donors, in terms of highlighting the time they spent. It was you had that opportunity to get seed funding. It could move on to validation funding, transition to scale funding, and all of that sort of staged funding support was beneficial, as well as what they have already mentioned, sort of this idea of accelerating their pathway through platforms and more targeted technical assistance. So as many of you know, SLAB hosted a development exchange each year in DC. They sort of fostered a community of innovators. They facilitated connections and relationships and partnerships. And again, that came out as really important, in addition to the more targeted activities of the accelerator itself, which gets us into the scaling part. The capacity building and technical assistance, again, was really important. And this provision of non-financial support with the multi-year financial awards. And again, it's not just that they valued it, it was also that it was something unique that SLAB was doing compared to some of the other funders in the same space. So those were all sort of the big picture achievements of what really worked well and what made it different from other funders and donors within maternal and neonatal health. Areas to strengthen or points of discussion that sort of came out from all of our different methods. Sort of a call to increase lower and middle income countries' key stakeholder leadership in the agenda setting stage. They were certainly there, but there was some feedback that it could be even greater. Likewise, strengthening representation of more LMIC-led innovations within the innovation portfolio. So about 83% of the awards were given to innovators whose headquarters were based in high-income countries, and just thinking more intentionally about what proportion would we ideally want to see, or do the donors and funders really want to see in terms of that portfolio balance and representation. There were thoughts and feedback about more having the program itself, because they are such a powerful convening platform, to more proactively link with in-country resources. For example, within USAID missions, the government, or the private sector. Again, there was certainly a lot of facilitation of connections, but I think for a lot of the innovators, being newer to a business model mindset, it was hard work, and some of them actually wanted even more support or opportunities to sort of embed their innovations into larger projects. So, for example, if USAID had a bilateral in Kenya, for example, that was focused on maternal and child health, would there have been a space to more easily embed some of these innovations for scaling? Laura touched a little bit on the business aspect, commercialization, this handoff of transition to scale. While there's the types of funding that you could get were seed validation and transition to scale, to notice that it really was not a full scaled up model for many of these folks yet. They might be working in a region or a smaller geographic area within a country, but lots of them had not gone the next step to an even larger scale. Although some folks were actually working in multiple countries. And then the last piece, which I hope will come up again in discussion, is standardizing sort of the metrics to benchmark the milestones of the SLAB innovations themselves and at the portfolio level. There was a tension that sort of showed up in different points about the public sector, the public sector public health impact, where you might have the most folks that are impacted by mortality, versus sort of business sustainability, which sometimes might not align with reaching the most vulnerable. Next slide. So a lot of what I just said is actually on this graphic, so I don't need to repeat it, but this is sort of a visual sort of pulling it together, that there's some more thought that could happen about potentially more targeting and engagement with local stakeholders on sourcing, scaling and thinking about whether SLAB or other types of programs like SLAB want to go that next step and fund the really large scale section, and how to sort of get more LMIC representation, because that could potentially also help facilitate the handoff transition as well. And I'll end there. So please read the report. I'll throw that in.
Great. Thank you so much, Joy Noel, squeezing a lot of information into the 10 minutes there, which is much appreciated. And you'll be able to find the full report online as well.